Okay, so let's continue. Now, we understood that when mast cells are activated, they become degranulated and histamine is released. However, this is only the initial or immediate response of the mast cells. Because mast cells, they have a delayed response. And this response includes the pathway of arachidonic acid metabolites, especially leukotrienes. And this can persist even weeks after the initial stages of acute inflammation. For example, if a question is asked, why does a patient still have signs of acute inflammation, let's say 6 weeks after the initial signs? What mediates such a thing? And the answer, this is mediated by mast cells, by their delayed response, which involves the arachidonic acid metabolites, especially leukotrienes. Okay? Now we have another important thing that we should discuss. When vascular changes occur, like during the process of acute inflammation, and when this subendothelial layer is exposed, we actually activate a certain factor. This is called factor number 12, aka Hagman's factor. Now, you probably know Hagman's factor from the coagulation cascades. However, you should know that when activated, it has two more important functions. First, it activates the complement system, and the second, in my opinion, is more important. It converts high molecular weight kininogen into bradykinin. And what bradykinin does, it's basically the same as histamine, because it also vasodilates the arterioles, and it also increases the vascular permeability of the post-capillary venules. However, it has a different function, a unique kind of function. It mediates pain. Bradykinin mediates pain. Now, this is important because we only have two things that mediate pain in the process of acute inflammation. One of them is bradykinin, and the other is prostaglandin E2. Okay? Actually, prostaglandin E2 mediates pain and fever. Okay? So now that we've talked about what mediates acute inflammation, let's talk about the cardinal signs of acute inflammation. Now, we have 5 cardinal signs for acute inflammation. First is redness, or also called rubor in Latin, and second is warmth, or also called calor. The third is swelling or edema, also called tumor, and the fourth is pain, also called dolor, and the fifth is fever. Now, what mediates each one of them? Now, redness and warmth, they are mediated when we have an increased blood flow. So, they're mediated via vasodilation. And what mediates vasodilation? Prostaglandins, histamine, bradykinin. Okay? Now, swelling. Let me just draw something right here real quick. Now, in swelling, let's suppose that this represents the increased vascular permeability. And this means that fluid can go from the blood into the tissue. Now, this fluid is going to be, and cells, of course, with that fluid. Now, this fluid is going to be filled with protein. So it is high in protein. The protein content is really high. The specific gravity is higher than 1.012. So this means that this fluid is going to be called an exudate. Okay? So, now this exudate occurs only when we have programmed increased vascular permeability. Because if we only have some kind of an osmotic, some kind of of an oncotic pressure right here, or a pressure that builds up and basically pushes the fluid out, this is going to be called a transudate. Okay? Now, an exudate, as we mentioned, has high protein and a specific gravity of more than 1.012, and transudate has low protein content and a specific gravity of less than 1.012. Okay, just so that you understand the difference. Okay, now pain, we talked about it. We said that pain is mediated by bradykinin and prostaglandin E2. Now fever is an important thing because, you know, when you have some kind of a something we call PAMP. Okay, and this is a pathogen associated molecular pattern. Okay, so this PAMP is going to be recognized by a macrophage. So this macrophage is going to release two things. It is going to release interleukin 1, and it is going to release tumor necrosis factor. Now they will go with the bloodstream and they will go into the hypothalamus. Now within the hypothalamus, they will increase the activity, remember the arachidonic acid pathway? They will increase the activity of the cyclooxygenase, so they will increase the production of prostaglandins, especially prostaglandin E2, which mediates fever. So it basically raises the temperature set point within the hypothalamus, and thus it mediates fever. We will continue in the next video.